Anemia is a common medical problem. Anemia can present as acute anemia or it can present as chronic anemia. Now let's see what are the features of acute anemia. The acute anemia becomes symptomatic depending upon the speed of development of anemia and the severity of the development of anemia, that is how much the hemoglobin has dropped, and the cardiovascular reserve of the individual that has developed this anemia. When the anemia develops, symptoms may be patient may develop weakness, fatigue, shortness of breath, there may be dizziness, lightheadedness, there may be thirst, sweating, palpitations, angina, even with sometimes normal coronary arteries, confusion, and coma. When you examine, you may find the patient is pale, there is tachycardia, sweating, patient is apprehensive, the pulse may be regular, sometimes arrhythmias also develop. If the drop in hemoglobin is very rapid and very large, patient may develop shock. That is, the patient may have cold, clammy skin, weak, thready pulse, low blood pressure, diminished urine output, and disturbance in consciousness. So this may be shock. So the patient may have all these features. Now, why acute anemia develops? It develops either because of acute bleeding or acute hemolysis. So if the patient is bleeding, there would be history of hematemesis, melena, or hematochezia. Sometimes there is internal unrecognized bleeding. You should always suspect. For example, patients with dengue may have internal hemorrhage which may not be visible, and the patient develops anemia as it goes into the shock. So one should always keep in mind these reasons that patient may have anemia. Then take the history of drugs, for example, non-steroidal anti-inflammatory drugs. They can cause or worsen existing peptic ulcer disease. Is there any history of dyspepsia? And does the patient have chronic liver disease? Then the second important cause of acute anemia is acute hemolysis. So patient will develop cola-colored urine, there is development of jaundice, there is fever, there may be abdominal pain. Take the history of drugs, for example, the drugs which can cause G6PD deficiency can present with acute hemolysis. Similarly, infections like malaria or babesiosis can cause acute hemolysis. And then if there is a transfusion history, the patient may develop acute hemolytic reaction. So look for the presence of bleeding and acute hemolysis for the symptoms produced by the acute anemia.